1. Despite the National Cholesterol Education Program's guidelines for treating healthy women with cholesterol-lowering drugs when their risk hits certain thresholds, there has never been a single randomized controlled clinical trial that shows that women who don't already have heart disease or diabetes benefit from taking a statin. I know this sounds crazy, but I'm the author of an article published in the medical journal The Lancet in January of 2007 entitled, "Are Lipid-Lowering Guidelines Evidence-Based?" which made exactly these points. 2. Eating a healthy diet is 3 times more effective than taking a cholesterol-lowering statin drug for preventing a recurrent heart attack. Contrary to what is generally thought, the healthy diet doesn't help by lowering cholesterol that much. A healthy diet style reduces the risk of heart disease by an assortment of other known and unknown mechanisms. Like a good magician, cholesterol-lowering marketing campaigns have focused our attention on cholesterol levels when we all should be focused on the real goal, reducing the risk of heart disease and improving overall health. 3. One study followed 7,300 healthy women for 31 years to see what risk factors contributed most to premature death. The contribution of elevated cholesterol to increased mortality rate was exactly 0. On the other hand, the Nurses' Health Study showed that women who followed 5 healthy habits developed 83% less heart disease and 91% less diabetes than women who don't follow the healthy habits. Eating a healthy diet, exercising regularly, don't smoke, don't drink heavily, and maintain a good body weight. Surprisingly, only 3 out of 100 American women adhere to these healthy habits. We are investing most of our healthcare resources in lowering cholesterol with drugs instead of helping women adopt healthy lifestyles, which would be far more effective and less costly. Americans now spend about twice as much per person on health care as the other 21 wealthiest industrialized nations. Of course, there's little that's more important than health. So if this is what it takes to get the best health care in the world, then most people think the high cost of health care is a necessary evil. But it's not just the cost of Americans' health care that's out of line. The really bad news is that for all the extra money we are spending, Americans not only don't have the best health care, we have the worst among the citizens of the wealthiest 22 countries. According to the World Health Organization, Americans live an average of 2.5 years fewer in good health than citizens of these other countries. Adding insult to injury, according to the World Health Organization, the efficiency of the American healthcare system, meaning how much health we get for the money we spend, ranks 72nd in the world. Can you imagine how long your employer would continue to buy services from a supplier that ranks 72nd in efficiency and was charging your company twice as much as your international competitors and achieving inferior results? Researchers from Dartmouth Medical School calculate that about 1/3 of American healthcare expenditures are now devoted to services that don't improve health and may actually make things worse. This means that Americans are wasting more than $700 billion per year on unnecessary or harmful health care. To put this in perspective, the amount we are wasting each year on unnecessary or harmful medical care is more than the entire budget of the United States Department of Defense. Corporations are struggling to purchase health care coverage for their employees and, by necessity, shifting costs to their workers in the form of higher monthly payroll deductions, higher deductibles, and higher copays,